Hello, my name is Hannah Garcia. I am going to review through a vulnerable population, including communication barriers among non-English speaking population. I have chosen this topic because my husband comes from a family who has immigrants, and some of them are non-English speaking, so I've had more exposure to this population. As far as my profile description of population, non-English speaking population, primarily the Spanish speaking population. In a study conducted on older Korean Americans with limited English proficiency, they studied whether physical and mental health were at a higher risk due to their limited English proficiency, or LEP. The conclusion of the study found that about 71% of those studied with LEP scored lower on every measurement of health in comparison to the English proficient subjects studied. The likelihood of having activity constraints was 2.72 times greater, fair or poor measurements of health was 2.59 times greater, and presumed depression was 1.73 times greater in subjects with LEP. In another retrospective study conducted at Boston Children's Hospital, they wanted to determine if non-English speaking patients had access to engage in clinical research in which they could potentially benefit from. The study found that the amount of non-English speaking patients increased with time, but the amount of studies approved to enlist non-English speaking patients in the Department of Anesthesiology and the amount of enrollment of these patients did not improve at the same rate. The conclusion of the study found that in order to improve the amount of non-English speaking patients contacted to engage in the research, they must increase cultural awareness and also implement investigators with resources for interpretation and translation services. So as far as the size of the population, locally, Weber Morgan County has 24,388 Spanish or Spanish Creole speakers out of a total of 225,285 speakers. Statewide, or in Utah State, there's a total of 245,945 Spanish speakers at home out of a total of 2,554,331 speakers. Nationally, in the United States of America, 61.8 million individuals speak another language other than English at home, with a population total of 329,541,394. Internationally, or worldwide, Spanish is the second most common language spoken worldwide, with a total of 400 million Spanish speakers. Differences locally versus nationally. Utah has a total of 9.6% Spanish speakers compared to 12.4% of the total United States population who speak Spanish. So contributing factors or social determinants of health include access to healthcare services, social norms and attitudes such as racism and stereotyping, and language and literacy. In the study reviewed previously titled Inclusion of Non-English Speaking Patients in Research, a Single Institution Experience, they found that despite the increased amount of non-English speaking patients, the amount of non-English speaking patients enrolled in particular research studies that could potentially be beneficial for their health did not increase at the same rate. Therefore, a social determinant to the non-English speaking population shows that barriers include access to healthcare. In another article titled Understanding Cultural Experiences, a qualitative study of Kenyans in America, they conducted interviews on immigrants who came from Kenya to America and found that majority of significant obstacles occurred in the first year after migrating to the United States, including stereotyping and racism, along with socialization aspects such as language barriers. These are examples of social determinants that are barriers related to social norms and attitudes and language and literacy. Contributing factors or specific concerns includes Pew Research findings that 18% of foreign-born Hispanics are living in poverty compared to only 13% of all Americans. A study published in Language Barriers and Access to Psychiatric Care, a systematic review, found that decreased language proficiency is highly correlated with underutilization of psychiatric healthcare services. Contributing factors such as root causes, a couple that I found, are why are non-English speakers at a higher risk of psychiatric health issues. Verbal communication is a large piece of psychiatric health and diagnosis. Language is utilized to find and deliver the correct treatment among immigrants and refugees, which creates a huge barrier when there is a language barrier. In order to provide psychiatric care and determine the correct psychiatric diagnosis, it depends highly on verbal communication between the patient and professional. Therefore, a language barrier can create a huge obstacle in receiving proper psychiatric care. A second one that I found is why are non-English speakers at a higher risk of health issues and healthcare access. It could be due to a lack of cultural awareness and a lack of interpretation and translation services, which can contribute to an increased amount of health issues and health access for non-English speaking individuals. Contributing factors related to Maslow's hierarchy of needs includes met needs such as physiological needs, which is our air, water, food, shelter, sleep, clothing, and reproduction, and self-actualization needs, which includes the desire to become the most that one can be. Unmet needs include safety needs such as health needs, resources, and employment opportunities due to language barriers, as well as love and belonging, lack of belonging within the American culture, as well as esteem issues which are unmet due to lack of respect and recognition from fellow Americans. So anticipated functioning level means that they're functioning at a physiological level because the basic needs are met, as well as self-actualization. Likely health outcomes. So based off of this is health outcomes for this particular population may suffer due to not having safety needs met, such as easy access to healthcare needs, as well as lack of belonging within the American culture, which could lead to psychiatric issues such as depression. Esteem may also be affected in relation to lack of respect and recognition from fellow Americans, which plays into psychiatric health too. Specific concerns including communicable diseases or infections, so tuberculosis TB cases among Hispanics or Latinos surpassed all other racial ethnic groups in the United States. 87% of all TB cases were among racial and ethnic minorities, and Center for Disease Control and Prevention reports that in 2014, gonorrhea cases among Hispanics were 1.9 times greater than the cases among Caucasians. Chlamydia cases among Hispanics were 2.1 times greater than the cases among Caucasians, and syphilis cases among Hispanics were 2.2 times greater than the cases among Caucasians. Specific concerns include non-communicable diseases or infections. So Hispanics have a lower death rate compared to the general population in the U.S. Hispanics have an equal rate of hypertension compared to the general population in the U.S. Hispanics have a 50% greater mortality rate from diabetes in comparison to Caucasians in the U.S., and a 23% greater obesity rate in comparison to Caucasians, 25% less colorectal screenings compared to Caucasians, and Mexicans in specific are approximately 2 times more likely to die from chronic liver disease and cirrhosis in comparison to Caucasians. So specific concerns related to self-care or self-harm. Older Hispanic adults and youth have a higher likelihood of psychological distress due to immigration and acculturation. Around 10% of Hispanics with a psychological disorder uses psychological services from general care practitioners, where 5% of Hispanics receive psychological services from psychological providers, which they are more in tune with psychological disorders. It stated that Hispanics have a higher likelihood of reporting poor communication with their healthcare providers. Also, 21.1% of Hispanics do not carry insurance in comparison to 7.5% of white non-Hispanic Americans. Low levels of insurance coverage for Hispanics is most likely related to ethnicity, immigration status, and citizenship status. Particular mechanisms that can be in place in order to decrease the issues affiliated with psychiatric issues include improving cultural awareness, promoting mental health in a language or display that non-English speakers can understand, and improving the translation among patients and healthcare providers. Specific concerns or risk for harm by or to others include, between the year of 2012 and 2015, half of the violent victimizations, including victims and offenders within the United States, were the same race or were both of Hispanic origin. Violent victimization consists of rape, sexual assault, robbery, aggravated assault, and simple assaults. Certain ways to mitigate this problem includes providing opportunities for non-English speakers to receive resources related to employment opportunities, which may decrease the level of robberies as well as potential assaults. The following 3 pages are my references. I hope that you enjoyed this presentation, and thank you.